knowledge. So I think that's the right person is Prasanna Kamath, who is working in Kolar Medical College, Devraj Aras Medical College. He's the head of the Department of Preventive and Social Medicine. So it's our pleasure to have you as a guest speaker for today's program, Dr. Prasanna Kamath. And I welcome all my teammates, that is all the state team of IMA KSB Ladies Wing, and all the president and secretaries. We are 22 ladies wing across Karnataka. I warm welcome to all of you, the president, secretaries, and even other dignitaries like past presidents are here, and other members who have joined the occasion. Warm welcome to all of you. Hope you carry the good memories and the good knowledge what Dr. Prasanna Kamath has. So hope all of us will have. I would request our President Veerbhadraya sir to address the gathering. Over to you, sir.
Sir is not there. I think Suri Raju.
Because sir was hosting a program at Tumkur. I think it's better we listen from Dr. Suri Raju. He's the honorary secretary, IMA KSB. Over to you, Dr. Suri Raju.
Good evening, everyone. First of all, I want to congratulate Ladies Wing, IMA Ladies Wing, for conducting such a wonderful topic. As we all aware, we conducted this April 7th World Health Day. So let us hear from Dr. Prasanna Kamath, Professor Community Medicine, Sri Devraj Aras Medical College. As we all aware, we know health is wealth, but how much we are taking care about our health is the question mark. Both physical as well as mental health. Today, like a silent epidemic, the mental health is causing a big problem in the society. And if you see, out of 10 patients, you come across 5 to 6 patients, diabetes, hypertension, or obesity. This has become, so rampant. Sometimes we had to rethink, are we going in the right direction? And should we do something? India is capital of diabetes. India is capital of kidney failure patients. And obesity, you see the obesity today in children. It is a big problem. And many of us are not getting good sleep. We are not exposed to the proper sunlight. And we are not taking care about our mental health. These are the big issues. And first of all, let us hear from our experts and what steps we should take to, for impactful society to make a difference. As a healthcare workers, we have huge responsibility. Not only the treating the disease, prevention is the most important thing. Same time, most of the time, unscientifically, this time the theme of the World Health Day is Together for Health, Stand with Science. Most of the time, sometimes even I am talking about, I'm a urologist. If you see kidney stones, out of 10 people, 1 person will go for scientific treatment. Rest 9 people, they think that all 9 non-scientific way of treatment. Maybe we should convince the people and tell that science is most important, follow scientific method. So thank you for giving me this opportunity, madam. I want to congratulate you, Dr. Padma Prakash, madam, for conducting such a impactful and useful program. Thank you, madam.
Thank you, Dr. Suri Raju sir, for your wise and wonderful words. Because as all of us we are aware, what is health? Health is a complete state of physical, mental, and social well-being, and not merely the absence of disease. I know how much doctors we follow these lines. Of course, physically we might be fit, but I think after 50 we have to be more careful. And more than that, mental stress nowadays what we are facing, especially in 3-tier cities, practicing is a mental stress, I personally feel. So I think let us hear from Dr. Prasanna Kamath.
Madam, Dr. Harish sir, President-elect also.
Okay. I think Dr. Harish Dilantabatu sir, over to you. We would like to hear from you also, sir.
Thank you, madam. Very good evening. And you being the chairman of the IMA KSV ladies wing have done wonderful job for the first few months. And I remember conducting International Women's Day last month. With that fond memories, you are going ahead in today's CME program, where we have a noted speaker, Dr. Prasanna Kamath from Kolar Medical College from the Department of Preventive and Social Medicine. It's wonderful to hear from him, and I wish the program a grand success. Thank you.
Thank you, sir. Thank you for your kind words. I think now I think Chinivalar madam, Sulochana Chinivalar madam will
Yeah, I am here.
introduce
You
Dr. Prasanna Kamath. Over to you, ma'am.
You are listening. You are hearing now.
Yes, ma'am, we can.
Dr. Prasanna Kamath, MBBS from 1988 to 94, Government Medical College, Ballari. MD Community Medicine 1998-2001, same WIMS, Ballari. Research and Publication 23. Presently Professor Community Medicine at Sri Devarajaras Medical College, Kolar. Experience of 24 years at the same college. Lead various sections, library, NSS, sports, BOS, PG studies at RGUHS, Academic Council member of the Academy, STUAHER, Kolar Core member of Medical Education Unit, STUMC. His areas of interest, mother and child health and occupational health, preventive health care to his people and the people of his area of residence, Hampi Nagar. This is the brief introduction of Dr. Prasanna Kamath. Thank you, madam, for giving me this opportunity.
Thank you, ma'am, for your kind introduction of Dr. Prasanna Kamath. His biodata reflects his dedication towards the profession. I think without wasting much time, let us listen from Dr. Prasanna Kamath. Over to you.
Good evening to all, and I'm indeed honored and blessed being described as an eminent speaker. To be fair and frank enough, I'm a bit tensed after having heard so kind words about me. Will I be able to stand up to the expectations? It is left for you people to decide. Without wasting much time, the message to me was a speech on health, healing, and wellness. Arogyave Bhagya. To this Arogyave Bhagya, always I would add on Anarogyave Aishwarya. Meaning to say that ill health is always associated with money and worldly pleasures. Once again, good evening to all my dear friends and partners in the single goal of health for all to the community through health care. Please note, through the health care, specifically as far as my specialty is concerned, it is primary healthcare approach. The first point of contact to the needy people visiting the health centers. In the other way of describing health is sound mind, sound body, sound action and function in a sound family, in a sound society. We extended it to the community and the country. It is so beautifully explained that there is so much interconnection between the individual as a part of his family, with his family members, his neighborhood, and the society. So WHO also defines health in the same manner as told by the secretary, the chairman of the Women's Wing, Dr. Padma, that health is a state of complete physical, mental, and social well-being, and not absence of disease or infirmity. But now they have added that since medicine, health is not a static one, it is a dynamic process of acclimatizing with the various demands of the daily living. And please note that health is defined considering that it is the expectation of the healthcare provider, like us all, including all the specialists and the super specialists who care for the health. But in this journey, in this struggle of providing the health to the people who visit us in need, shortly, they can be addressed as the patients visiting our health setup, expecting a relief for their difficulties and the problems. We are stuck with managing and addressing the expectation of the people only in terms of the physical health, forgetting about the wholesome approach of the health of the individual depends upon the various factors. It is multidimensional. The other three dimensions of importance which the WHO has included of late happens to be the spiritual dimension, along with, as expressed by your esteemed members, we doctors are caring less about our own health and more so working in the 3-tier cities. This is what is expressed. So we all are aware that the vocational health working at the working place also plays a significant role in addition to the social and the emotional background for this particular health. But in this approach, in this expectation of the people, we are trying to adhere to the only physical aspect of the health, which is of utmost concern for the people in expectation. That is, a person visiting us expects that he should be relieved of his problems. According to him or her, the problem happens to be symptoms only. And once his or her symptoms are relieved, he always feels that he is relieved, he's got his health back. But we, as the enlightened healthcare providers, taking the oath that we are responsible for health for the people who are visiting us, we tend to address the basic expectations of the people in need, that is the physical dimension of health only. In this matter, we forget about the other closely related thing called as well-being and healing. According to the expectation of the patient or the person in need, he is healed once he is relieved of his symptoms. His problems happens to be his symptoms. It may be cough, it may be fever, it may be diarrhea. And if he is relieved of this, he feels that he has healed and he is engaging, he is enjoying that state of health wherein he can perform to his maximum ability. But we, from the healthcare setup, in this, I don't want to brand it as hastiness or whatever it is. Let me not speak ill about all healthcare providers. In the hastiness of fulfilling the basic minimal expectation of the people. This is not generalized statement, but this is the observation of mine in this past 25 to 30 years of my journey as a medical health provider or healthcare provider. We tend to satisfy the superficial need of the patients and make them feel happy. I won't say that we are forgetting about addressing the problems which he has not noticed, but which have contributed for his difficulties. Maybe that in the government machinery or in the outpatients, the number of patients, number of people in need are so many that we won't be able to. But I don't think so. We are justified in denying what we had assured as doctors when we had taken the oath. As basic medical practitioners, one famous personality by Henry Seagert, if I remember correctly, Henry Seagert, he had defined medicine. An obligation of a service-oriented duty of a doctor to provide preventive and promotive services along with therapeutic or curative services. Hope I'm able to remind my esteemed members all these statement of the famous personality Henry Seagert. That time itself, it had been defined that medicine profession addresses two particular entities, not only the curative and the therapeutic services, but also the preventive and promotive aspects of the healthcare providers. I don't know whether I am wrong in saying that we have forgotten that particular role of the healthcare providers, or because of the various reasons we are not doing it. But this is, I don't know, it is a sad note of affairs on the aspect of the healthcare provider. But as long as the people in need who visit us are happy and they are healthy according to their needs, we are not troubled. But now the information is at the click of the button. I'm not telling it is the knowledge. The information is available at the click of the button, and every person on earth are having smartphones, and people, they feel that they are smart enough, knowing all those things, not knowing that they are informed about all those things, so that they have got plenty of questions. There are plenty of questions. Some of them, they are not justified at all. But in this journey, in this hastiness of, we should be aware of not forgetting about the primary aspect of the healthcare providers. That is to make all the efforts to help the person to regain his or her health, to regain his or her health by the curative measures, and also address the various problems, the factors which might have contributed, the various problems, the factors in terms of risk factors or in terms of etiological factors existing within the individual, existing in the society, at home, or at the place of work. Even they need to be addressed in managing the situation, so that at the end of the management, if we are able to, just definitely we'll be able to communicate about the problems or the factors which the person is having in himself or herself, which all have contributed, which all might have contributed for his present health status. Please note, his present health status in terms of the illness or the sickness. Once we make an effort to convince the people about the problems which are existing in them and surrounding them, and explain them probable modalities of investigations needed for confirming the diagnosis, and in turn, the probable treatment modalities, they definitely will make an effort to understand and be a partner in this journey of treatment. Also, along with that, preventive and promotive aspect. Initially, they will be concerned about the curative services. And once, if we are able to make them a partner and develop the trust between the doctor and the patient, this trust goes a long way in encouraging the person to follow the instructions, follow the guidelines, not only with respect to the treatment, but also the preventive measures. And after about 2 or 3 days, which play a crucial role in alleviating their symptoms, and to a certain extent, their causes also, once they come back for follow-up, with their positive impetus, or positive feeling they would have developed towards our treatment and the management, they will be eager, they will be patient listeners for the further advices. So this healthy relationship, addressing in the initial 2 or 3 days, can be cultivated into a long-term relationship, extending the preventive and promotive services and convincing them what they can adhere to and adapt, so that we can be fully confident in assuring that well-being, assuring that wellness, what they are expected to expect from us, even though they are in need of only alleviating of the symptoms. In this journey of managing that particular problem and the disease, in this establishing the trust and the rapport, we would have made them a positive partner in this management. Definitely, they will be convinced to adapt and adhere to this promotive and curative services. In this journey of providing the healthcare therapeutic services, we would have earned the trust of the individual and his family members, which will be the public relations officer for our practice, our establishment. This goes a long way in establishing our patient compliance. With this, we would have attained the health what was expected to have attained by we taking the Hippocratic Oath, as established by not only providing the treatment, alleviating the symptoms, but also the proper care, proper health, so that they will be able to go back with confidence, either to the workplace or the place of residence, with the surety that they have gained that well-being or the wellness, which is supported by their belief that not only the therapeutic services, but also the promotive services will be able to protect him from the future recurrence of the same diseases, or enable him or her to protect himself or herself from other similar conditions. So this rapport can be extended for the other members who would have accompanied to our healthcare setup. But this needs a lot of patience and time on the part of the patient as well as the doctors. I am not saying it is impossible. It may be very difficult to manage this, but it is always better, as we have been trained, as we all had been trained, as a basic medical doctors during your undergraduates, and we have specialized upon that particular basic knowledge foundation imparted to us by our esteemed teachers. I remember almost all my teachers having involved in this healthcare to be provided by being the first person of contact even in the tertiary healthcare centers. I am very sorry to say that of late, this first hand contact of the doctor per se, who happens to be the team leader of the health team, is missing in action on getting this confidence of those inpatients in the hospital, as well as after having performed various investigations and providing the treatment, we are being missed out. Please note that we, being the leader of the health team, providers of the health, assuring them well-being and the wellness, we should be in the forefront of this team. This team comprises of our interns, it may be the postgraduates, the laboratory workers, the nursing staff, all those people. But we should always be in the forefront of providing this at least once per day, in providing them the assurance that the treatment, whatever has been established based upon the investigations, understanding the problems, are in line, and they will be assured of their wellness and well-being at the end of the journey. With this, I would like to add a note on the wellness also. The wellness is addressing the holistic concept of health. The holistic concept addressing almost all the dimensions of health, which the WHO has included the four among them: the physical, mental, social, and latter spiritual. To these two other two other dimensions which are included, which are adhered to by the wellness of the person, are the emotional quotient and the social aspect of the health, along with the emotional component. Why? Because we are all human beings, we are all social animals, we tend to interact with the people within the family, in the society, at the social gatherings, at the working place. The mental health adheres to, mental health is meaning that it is the self interaction, self introspection to find out that we are capable to perform to fullest ability of ours, overcoming and developing those coping mechanisms to overcome the stress and strain, and impart that much amount of work capable of fruitful production at the place of work. On the contrary, the emotional or the social well-being addresses to the capacity of the person, how capable he or she is in interacting with the people at his home, people at his working place, and people whom he or she comes across in the society. So let us hope that we will be able to, we all, the healthcare providers, physicians, the doctors, capable of imparting or providing health in a comprehensive manner, not forgetting about the promotive and the preventive aspect, so that every individual on the earth, every individual whom we come across will be receiving that personalized, well-established treatment based upon sound scientific knowledge. I am touching upon the sound scientific knowledge. Why? Because for this year, the WHO Day 2026, the theme happens to be Together for Health. But for this provision of health, all of us have to come together with science as the basis. Why is this important? Why is this important? This is important at this point of time from the perspective of three stakeholders of health. The primary stakeholder of health happens to be the person in need who has visited us. The secondary stakeholder of health happens to be the community or the society which the person is ailing from or residing in. And lastly, and the foremost important component, taking the pride in that, we have assured that we all will be capable of providing the expected health on the expected lines of a healthcare provider. Maybe that we won't be able to fulfill all the expectations of the needy people. It is not one. We should try to fulfill at least the basic responsibilities what we had assured, what we had taken the oath upon, that empowering the people, educating them, with the requisite knowledge and the skill so that they will be equally responsible with their community participation by taking responsibility of their own health. Taking responsibility of their own health by being a partner in adhering to the instructions of the doctor for curative services, adhering to the instructions of the doctor based upon those preventive services, it goes a long way. But science, why science? From the point of view of the doctors, I have told you earlier, we in this busy world, in this AST world, based upon the various expectations, we are all trying to move very fast and take care of all those people within short notice, short time, without bothering to, explaining the people about their role in this success of this treatment. When this can be imparted, when this can be assured, it is only when those people are explained scientifically the need or the basis for his difficulty or the problem which he has come for. It has manifested because of all those problems. This scientific basis, scientific knowledge, we should strongly use in educating the people, imparting the knowledge, so that they will assure, based upon this knowledge, whatever they would have gained, that they will be a partner for this journey. Way back in 1948, when the WHO was established, this health was defined. And now of late, recently, the WHO Director General, that is Ghebreyesus, while making an announcement, is clearly told that science is one of the most powerful tool. Science is one of the most powerful tool for humanity, for their protection of health and in turn to improve their health. And we all know that. We all have been taught, we all have been certified that we have been doctors based upon the scientific knowledge we have gained in understanding the difficulty, in understanding the diseases, in understanding the mechanism of the drugs, in understanding the most effective treatment. But my dear friends, we should be able to utilize this knowledge, whatever we have gained, utilize this scientific knowledge, scientific basis, what we have gained in educating the people and making them the partner to accept this scientific basis of their treatment. I heard from one of the speakers saying that among those 10 to 12 people, nephrology point of view, the people with the renal stones, only about 1 to 2 people are interested in adhering to the instruction of an allopathic doctor, whereas the remaining of them are not so much keen upon. This may be the truth or the reality. I am not contradicting this statement. I can assure that particular doctor, the nephrologist, and the other doctors that we can make a sincere effort by spending some meaningful time, by sharing the knowledge, scientific knowledge, evidence, scientific basis for their difficulties, why the stones are being formed or why the diseases they are having, and assure them that the scientific technology advancement, whatever we have made, is going to provide them the best probable treatment for their condition and assure them regaining that particular health, whatever they had before facing these difficulties. The simplest of reasons happens to be, simplest of them happens to be the recent COVID pandemic. Please excuse me. COVID pandemic, it was a blessing in disguise. I don't know how many of the doctors felt that this was a blessing in disguise. Why? Because when every other manner of treatment, every other school of treatment were not so successful or were a failure, it was our scientific knowledge, it was our scientific evidence. It may be in terms of vaccination, it may be in terms of isolation, it may be in terms of community participation. We were very successful in managing that pandemic and bringing that to a control level. Even now, 1 or 2 people may be using that, but we happen to see the wholesome, the entire community accepting this minimum basic preventive measure of masking, cough etiquette being followed, hand washing to a certain extent during the period every one of them are doing. We can take this example. Taking this example, I am not telling that we need one more pandemic or we should scare the people to their core. The basic important thing need of the hour is to take the patient or the person in need into confidence by explaining them the scientific basis. This needs not more than 5 minutes, sometimes about 10 minutes. Sometimes we may have to answer some of those questions, whatever they would have gathered based upon the information. But all these things said and done, we have not lost anything. We have not lost much. I can assure you that we will be very successful in regaining that confidence or the trust. Why I'm telling it regaining is, of late we have been seeing so many number of cases, litigation in the society, in the hospitals are being blamed, some doctors are being trashed, all those things. When I have discussed with all those people who have been affected by this, maybe the hospital or the nursing homes or the healthcare providers of the team, what I have noticed is either the team has not explained patiently enough the present health scenario of the patient, patiently enough the probable modalities of treatment based upon their time of presentation, and also about the prognosis, the probable prognosis of the treatment. So these were noticed in almost all these cases. In almost all, that doesn't mean out of the 100 of the cases, but majority of those cases against whom the patient and the community, and sometimes they're all whimsical and sometimes they're all motivated by other reasons. I won't deny that. Depends upon the individual family members who face the same scenarios at their healthcare setup. But since I am working in a medical college hospital and I am in regular contact with the district healthcare machinery of my district, I tend to be in some of those committees where there will be inquiry conducted for all those things. So what I have noticed and what I would like to request all my esteemed members is, please spend meaningful time. In explaining to the people. Let the doctor in contact, the first person in contact, let him or her take care of the emergency situation to revive the health. As soon as the first aid measures are being provided, there is time in between. Never forget the people who are accompanied, because even they will be sensitive, they will be emotional, and emotionally driven people, they behave very badly. I am fully confident about this. But being the healthcare providers, it is our responsibility to take them into confidence. Please, none of the members who are being part of this particular discussion or interaction may feel bad about it. It is just a general scenario, what I have come across and what has been noticed as a common factor. The common factor is miscommunication or misunderstanding or lack of communication, giving rise to lack of understanding and not making them a partner for this particular treatment. So with this, I think I should be able to conclude on a happy note that majority of those healthcare providers, as far as the various national programs are concerned, it may be towards tuberculosis, it may be towards the pandemic, or it may be towards the leprosy or other communicable disease where national programs are functioning. I would like to congratulate each and every of those doctors in our state. Please note, doctors in our state, that we are always at the rank number 1. And as far as the tuberculosis program is concerned, RNTCP or the NTEP program, the contribution of the state branch of RNTCP has done a commendable job in collaboration with the private agencies and the government agencies in attaining those targets which were fixed by the WHO in collaboration with the government of India. We are in the forefront, always ranked number 1, for which all the doctors have been actively, committedly responsible for this program. Likewise, for other programs also, we, the state of Karnataka, are proud to state that we doctors have contributed for attaining those various goals. With this, I would like to conclude to state that all of us, we doctors, would like to take back or remember that we have all assured the people that we are responsible for improving their health to that level wherein they can forget about they can not fear or be afraid of the recurrent illnesses, and they can perform their work to the fullest ability with this positive health. This can be attained through the universal health coverage of the WHO, which has been assured, which means health care for everyone, everywhere, anywhere in the world, irrespective of the caste, creed, and the society and the capability of functioning. This can be attained by the care in the real sense, which includes the promotive, preventive, and curative services. Thank you, one and all. And I would be eager to respond to a few of the queries about my comments. If at all I have hurt anybody, I'm very sorry for that. I don't have any intention of hurting anybody, and I am thankful and indebted to all those office bearers of this IMA Karnataka State Branch, and mainly to the Women's Wing for having given me an opportunity to share my views about the healthcare providers, and the present existing health status of the people in our country. Thank you and good night. Good evening. Over to you, madam.
Thank you, Dr. Prasanna, for your exceptional presentation. In spite of preventive and medicine, you just covered the clinical and even including the COVID as well, because you were just mentioning about what are the problems. I think the communication is very important among doctors. As soon as we get a patient, as you mentioned, in 2 or 3 days, when you communicate them, we should get the confidence of the patient. Then only we can treat in a better way. It's not only treating the physical, we have to treat the mental issues as well. We have to give most confidence, boosting words. They are very mandatory. That's what we feel. I think that experience will make us more perfect to handle the patients clinically. I think Dr. Yoganand Reddy sir was there. I think he has just left. Dr. Anuradha madam, any questions from your side? Dr. Anjali is there. Dr. Suresh, Dr. Shobha. Satyavati, any questions from the audience, please? Dr. Anuradha Parmesh.
Yeah. Good evening, Dr. Padma.
Good evening.
Yeah, health awareness amongst our fraternity is the call that is required, because we think patient health is our priority, and we never think anything about ourselves. So Dr. Prasanna has given that message, and the last concluding message that he told was about the concern the caretakers have. So we doctors need to spend some time with the caretakers. My personal experience with 41 years of practice is the caretakers keep changing. Today the mother is there, tomorrow the mother-in-law is there, another day the neighborhood auntie will come, another uncle will come, and after finishing a thorough counseling, you get another person coming in, walking in, and asking questions. So my personal experience and my personal suggestion is, first and foremost, before counseling, you'll have to find out who are the people who are available there, and then decide who is the decision taker and concentrate on them. I prefer not to speak to all the people around. I will just call the husband. If it is a delivery patient, just call the husband and call the mother-in-law or father-in-law immediate first, because I find it very difficult. Today you say cervical dilatation hasn't happened, etc., etc., and then when you come back and you say you want to do a cesarean, the same crowd you can continue your conversation, but when the crowd is different, you'll have to again come back. So I think in any situation, whether it is ICU or whether it is follow-up, heeding to all the caretakers will definitely be a challenge, is my personal experience. And coming back, health, for our personal health, Dr. Padma, I think you have been taking a lot of daring steps, different types of webinars, etc. Doing what to say, health checkups for our own doctors, I think we'll have to include it in our CMEs. At least that is what I'm trying my best to do. For the next CME in Bangalore branch, I plan to have one BMD, hemoglobin, blood pressure checkup for our doctors, not for the public. I'm always for our doctors. This is what I wanted to say, and definitely, Padma, every webinar we have something new to listen to. So each one of us look forward to different what to say, views of yours. And Dr. Prasanna, yes, good presentation. You did highlight a lot of points for all of us. Thank you.
Thank you very much, madam.
Thank you, madam, for your kind words. Just, I want to highlight that I'm the Vice President of IMA Yelahanka. So in our branch, once a year, we do have health checkups for doctors. I think latest we had, ophthalmologist department, they've taken up, free just eye checkup for the doctors. So most of the time, once a year at least we'll have from Yelahanka. So I'm really proud to say that from our branch, we are taking initiation because we are almost 600 doctors in this branch, Yelahanka branch. Thank you, ma'am, for your wise words. Any other questions from the audience? Sulochana madam, Dr. Anjali is here, Dr. Suresh, Dr. Shobha, Dr. Satyavati, Rajeshri is also here.
Dr. Prasanna, sir, very good presentation, Dr. Suriraji. Sir, actually,
Thank you, sir.
I totally accept what Dr. Anuradha madam says, because we doctors don't take care about our health, sir. If you see overall survival rate of doctors when compared to the general public, we live, we live 10 years shorter when compared to the general public. We think that, we live long, we don't get any disease. That kind of attitude is there among the doctors. We never go for health checkups and never go for even vaccinations. Now, vaccinations like HPV vaccine, HPSC, all those things are there, sir. But doctors, we don't take care. About this, what is your idea, sir? What is your view?
I think there is a very nice observation being made, and the various studies also have proven beyond doubt that the death of a doctor is 10 to 15 years earlier than general community. That may be that they are having the common risk factors as a common person, as well as the stress what we experience at a working place. All these things can be managed. They are not impossible to be managed. It is that we should be able to find some time for our own self, because man is a social animal and we are also human beings. The doctors, basically, we are also human beings, and we tend to be spending more time with those patients or the people in need. Keep on listening to them only, and we develop that same attitude towards that. So in between, or we should fix a time after our consultation hours, that this is the time wherein I will not be mixing my practice with my personal social life. We should be able to spend meaningful time with our own family members, with our own neighbors and relatives, and participating in the social gatherings without foregoing. And we always have believed that our job is service. We can't forego the patient's health, consider their health as a priority. But this is one wrong notion, sir. We have to fix instead that these are the 5 days which I will be working, taking care of the patients. The remaining 2 days are for my family and myself. If we are able to fix, because I had come across few of the doctors when I had visited to this Madikeri region, there majority of the doctors, the practitioners, they clearly told that I practice only 6 days a week. Sunday, I am totally away from the city and society. I'll see to it that I discharge all those troubling cases. I mean, manage the cases for those 4 to 5 days and see to it that at the end of the day, they're not having any of those emergencies wherein they have to be at the need of those people. They will be manageable by the other healthcare providers even in their absence. So this they have established a regular practice. That's what I got to know from those clinicians in the Madikeri region. I don't know whether it is applicable to the others also, but off late, not like earlier times, off late, I happen to see that. I happen to see that the clinicians take that Sunday or one day totally off away from their practice and spend meaningful time with their family members and friends. So this interaction, spending meaningful time with our own family members and our friends, brings about that relaxation mentally, physically, and socially also. And we can return back to our job with a fresh state of mind. And this goes a long way in taking care of our own health, sir. And the second thing is, in this hastiness and the stress for caring for those patients, the people, our food eating habits are very irregular. We don't stick on to the preferred meal time what we were doing before our doctor's job. Whenever time permits in between, we try to eat. This disturbs the circadian rhythm of our own body, the juices being secreted in our body, and will having a negative impact of our own health. The second thing is about the sleep, the rest time what we have to. Any human being for that matter needs a meaningful sleep in the real sense of 6 hours during the night time. And we all know because of our studies, knowledge, whatever we have gained, it is during this resting period when we are sleeping meaningfully, our enzymes, our hormones, and the body cellular functions perform to the maximum to regain, to replenish whatever we would have lost in that journey. And lastly, and the most important thing is, in addition to the relaxation, food at the right time, sleep ideally for 6 hours in the night and half an hour of power nap in afternoon. The most important thing is the physical activity, at least 20 minutes, at least 20 minutes per day, 6 days a week or 5 days a week, 20 minutes per day or 5 to 6 days a week, exclusively do some amount of physical activity. It may not be aerobics, it may not be gymnastics, it may not be weightlifting. It may be a simple walking. It may be a stretching exercises. It may be yogasana, whatever it is. 20 minutes of, minimum 20 minutes of exclusive physical activity for our own self, 5 days a week. These 4 to 5 things, if we follow strictly, this is the fifth one is stick on to these above 4 things, 5 strictly. This is the fifth message, sir. These 5 messages should be able to help us working to the fullest possible ability with the intention of caring them as well as caring our own self. Thank you, sir.
Thank you, doctor. I think these
Prasanna, I have
simple
one
words,
query. So
work-life balance, correct?
which age group you are advising this? How can we take 6 hours rest, eat on time when we just complete our graduation and join a nursing home or a primary health center or as a duty doctor, whatever? And what about like once we start, complete our post graduation at the example 27 or 28 years, how we expect us to work schedule what you're just mentioning? Because we'll be working as a junior doctor or a junior consultant. So by the time we become the consultant, we'll be almost 35 to 40 years. But still we are called to do the night duties, especially the clinical side. So is it very practical that what you're talking about? As of course, once we cross 50 years, we will realize that, okay, till 50, we'll be running behind patients, name, fame, job satisfaction. We want to have our own identification in the
Yes,
profession.
definitely.
I think these words will hold good only once we cross after 50. By the 10 where we would have established professionally,
Madam,
isn't it?
I fully appreciate and fully understand what you're trying to express. ಅದಕ್ಕೆ ಸ್ಟಾರ್ಟಿಂಗ್ ನಲ್ಲಿ ಹೇಳಿದ್ದು ಆರೋಗ್ಯವೇ ಭಾಗ್ಯ ಅನಾರೋಗ್ಯವೇ ಐಶ್ವರ್ಯ ಅಂತ ಹೇಳಿದೆ. Without any ill feelings or offense meant to anybody, madam, in that beginning of our journey of practice, in this beginning of our journey of medical practice, we will be developing that attitude of running behind the patients, running on time for the patient. Fair enough, do it. But from the beginning itself, if we make it known to the people in need that I will be available at 9 o'clock, I will be available from 9 to 12:30. From 12:30 to 3 o'clock, it is my time and other activities. After 5:30, I will be available up to 8:30. If we fix these timings. So for a clinician, it may be a physician. For a physician, morning 3 hours, out of that 2 hours you spend with outpatient, remaining 1 hour, that is 9 to 12:30 May, 2 hours for your outpatient, and remaining 1.5 hours for the inpatients can be done. After that relaxation, then once again come back fresh in the evening for outpatient itself and only for those IP in need. So if we close the shop of this practice by 9:30, we'll be able to reach by 10 or 10:30, maybe the distance traveling, all those things, and sleep by 10:30, 11 o'clock. But even though you sleep by 11, up to 5:30, it will be 6.5 hours, madam. Up to 5:30, from 11 to 5:30, it will be 6.5 hours. I am asking you people to have a peaceful sleep of 6 hours only. So even though you get up at 5:30 or 6, 5:30 if you happen to get up, we can make use of that 5:30 to 6:30 for pranayama, yogasana or relaxation or physical activity or workout for yourself. Then come back, freshen up, have your breakfast or snacks and go back. This is with respect to the clinicians, the physicians, medical specialties. This is the general thing, what we can do it. It is not wrong. Now, what you yourself mentioned that by the time we realize this and we would have been thinking of relaxation, we would have reached the age of 55 years. But nobody would have expected us to do this, not to do this from the beginning. We would have accepted that willfully because of whatever reasons. Because of whatever reasons, we would have accepted that willfully at the beginning of the journey. So later on, it becomes a habit and a practice, and even the people get used to that. Then that is the time wherein we find it difficult to change and find time. But it is always possible, madam. It is never impossible. It may
True,
be
I agree
difficult
with
to
you,
begin
but
with.
what about the surgical obstetricians, surgeons, emergencies,
Yeah,
urologists, orthopedicians? So, and they'll be working as a junior consultant. So, I think what you are just saying, we should motivate our, the younger generation, the doctors who are coming up. So, we have to educate them, motivate them to practice this kind of practice in
exactly.
the beginning itself, so that they'll have a peaceful life in the coming years. I think we should educate younger generations, right?
Exactly, madam. We being the senior consultants, you all being a senior specialist in your own field, you having experienced these all these difficulties during your younger age, now realizing that which could have been done can be taken as an example, evidence-based example for those young consultants. For that, they will be convinced to start the journey on this note from the beginning itself. Without hastiness towards performing, they can relax, take care of their own health, their own members, and then take care of their immediate responsibility of having become doctors. So we seniors should be a role models for our youngsters, which we could not be for ourselves. Thank you, madam.
Thank you.
Padma, I would like to say a few words on this.
Welcome.
Dr. Prasanna, what happens
Yes,
is, as a beginner in your profession, there are two aspects here. One is you're very clear about what you want to do. Another is you don't know how to take a decision. So my personal suggestion is we have enough of our professors, teachers, god brothers, godfathers, etc., who will definitely guide us. So Padma, you can definitely, as Dr. Prasanna put it, you can definitely decide what you want, whether you want to be busy, whether you want to devote time to yourself, to your
All in the
family.
mind and the heart.
Yes, it is possible, Dr. Padma, but only thing is very sensitive, very delicate to take a decision. You want to be busy, but you also want time for yourself. It is possible.
I'm not denying that we have to do or we can't do that. The major thing is, ma'am, once we complete our post graduation, we'll be in a zeal to have that, kind of job satisfaction or financially to be stable or to have a name, fame, stuff. Most of us, it's, I think 100% of the
Yes, yes.
doctors they have, unless we have some father or the grandfather having a nursing home, do some administration or just take care of the patients, what they have taken care all these days. We want to have your own establishment. So I think most of us, doctors who are present in the webinar, I think they do agree with me that and we'll be quite young and energetic also. So we will be like putting lot of efforts and we'll be working as junior consultants, and they expect lot of they extract lot of work from us. Even we feel that job satisfaction. So that makes us, the adrenal surge will be there to work more and more. That's what I'm
Exactly.
saying, that now
Exactly,
we have
madam.
to
You're very
set
right
an
in that.
example. We should set an example, to the younger generation, or advise them to how to take care of their health initially itself once they complete their graduation or post graduation. So we should talk more about these topics in the coming, JDNs or medical student
Yes, ma'am.
network. So we should approach, this should be the topic for discussion, I feel.
Yeah, Dr. Padma, last Medical Student Network, they had a presentation. And, in the question answer session, the topic was kidney. And you know what the question was from the students? Well, I'm eating junk food and I'm not able to maintain good lifestyle, etc., and all that. So as a senior, you know what I said? I said, you continue to eat your junk food, but what you need to remember is basic lipid profile if in case you are having any issues, basic simple urine test. All those things will let you know whether your kidneys are really doing good or not. But don't get scared that just because you're eating junk food that you're going to have some renal failure, etc., etc. So like that, what happens is that apprehension is there for the students. And I was able to clear quite a lot. And my message for them was, you continue to eat your mother's food. And if you are a hostelite, you continue to eat idli dosa as a South Indian. As a North Indian, continue to eat your chapati parota. Along with that, you eat the junk food. You cannot simply eat junk food and then suddenly you have problem. And the last message is, annual health checkup is a must to each and every one of us, even the medical students. I think that message, I want to give it to everybody. Your lipid profile, your mammogram, your pap smears, your regular adult vaccination, there is no compromise at all. We have to have our health checkups. Our doctors are scared to get the BP check because they get the GRBS done, thinking that ಅಯ್ಯೋ ನಂಗೆ ಶುಗರ್ ಇದೆ ಅಂತ ಹೇಳಿದ್ರೆ ನಾನೇನ್ ಮಾಡ್ಲಿ ಅಂತ. That is another group of doctors. Anyway, some message that I want to give to my colleagues is, you do your lipid profile, you take care of your family. The delivery patient will come and go, ICU patient will come and go, but our family members are our priority. And more before that, add yourself. Have you had your did you eat dosa in the hotel of your choice? Did you wear the sari of your choice? Did you take care of your mother the way you want to take care? I feel that is the question that each one of us have to ask. Did you sleep well yesterday? Can you sleep today? That is what I want to tell my colleagues. Thank you.
Thank you so much, ma'am. Anybody? Dr. Rajeshri, would you like to add upon something?
Yeah, now that
Sulochana
we
madam. Yeah. Dr. Rajeshri, after that, Dr. Sulochana madam.
yes.
We have to take care of our health, and also we should include yoga, pranayamas to build inner strength so that we will work stress-free. That is my experience. We have to do pranayamas. This health, inner self, building our inner strength is more important, especially in our, what I have found and I am experiencing, so that we can keep our mind cool. Even with our efforts, sometimes we come across failures in our practice. This is not because of our negligence. Now, especially these media people and all are making so much scenes that we are negligent like that. But to overcome all this, we have to keep our inner strength strong so that this can be done with all these pranayamas and all, I feel.
Now, ma'am, thank you so much, ma'am. Dr. Rajeshri, over to you.
Yeah, see, how much ever we talk, we are still in the Indian setting, you know. We talk about these graduates, MBBS graduates who get married after MBBS. See, the moment the girl gets married, you know, her focus will be entirely on the home she enters. Whether she marries a doctor or a non-doctor, she will never have time to look after herself. That much I've seen. It's not just seeing one or two. It's like overall I've seen until she becomes some 40, 45, until the kids grow and probably they come out of the school, she'll never have time to look after herself. Probably we need to mentally prepare them that from the beginning they have to look after themselves. That means they should have a boundary so that they should have their own time. They should have their own time, whether it is an exercise to be done or yoga or meditation. I can absolutely say that 26-year-old lady doctor, you know, she would not married. She would not find time to do meditation or exercise or yoga or anything.
Thank you, Dr. Rajeshri, for your inputs. I think let us come to the end of the session. Dr. Satyavati, over to you for vote of thanks. Dr. Satyavati, Idira?
Thank you, Dr. Padma. I thank team IMA KSB and KSB Ladies Wing for have conducted such a wonderful webinar. It was very wonderful. It was very informative. And I thank the speaker, Dr. Prasanna Kamath, for giving this informative session on World Health Day. And I also thank all the participants to have participated in this webinar. Thank you.
Thank you. I think next month, second Tuesday, between 9 to 10 p.m., let us all meet with a new, innovative, very good, interesting topic. Till then, take care. Bye-bye. Good night, all of you.
Good night.
Good night, Tony.
Good night.
Good night, madam. Good night. Good night, everyone.